Hey, welcome back to another episode with Kinesis PT and Performance. This week we're going to be addressing some questions we had about last week's video regarding stretching your hamstrings and low back pain. So just to recap what we talked about in that video, a lot of people think that they can fix their back pain by simply stretching their hamstrings, and we discussed how stretching your hamstrings might actually make the problem worse by allowing your pelvis to tilt even further forward, further compressing some things in your back, whether it's the nerve roots or the facet joints. So what we're going to talk through today is actually how to use your hamstrings in conjunction with your internal obliques and your transverse abdominis to help reposition your pelvis underneath your rib cage to get everything lined up so we have space for the facet joints, we have space for the nerve roots, and everything can be happy. In addition to that, we're going to show you another way to kind of open up the front of your hips or your hip flexors to just help reinforce that. The first thing we're going to show you is a 90-90 supported hip lift. This is a PRI non-manual technique. Excuse me if I don't use the exact verbiage. People in PRI are very specific on the correct words and what they use in the manual, and I'm just kind of free rolling here, so I know it's not going to be exactly how they term it, but this is essentially what we use to help engage your hamstrings, transverse abdominis, and internal obliques to pull the pelvis back underneath the rib cage, get that lined up so we can create a muscular canister for your core to function properly and create space in your lumbar spine. If you don't know what I'm talking about when I say muscular canister, go back and look at our video on how the core functions. It'll explain some things for you, make that a little bit easier to understand. So essentially what we want is our person lying on a flat surface that is somewhat firm. This is not a real cushy table. So if you can be on the floor, the best thing is on the floor with your feet up on a wall. So your hips and knees are bent to approximately 90 degrees. We want her feet to be about hip width apart, and she's going to hold this little ball in between her knees. So this ball here is about 3.5 to 4 inches in width. You can use a towel roll. A foam roller might work if it's not too wide, but essentially we want to make sure her knees are angled in and less narrow than her stance is here, so meaning her feet are wider than her knees. So once we got her in this position, I actually like to use the cue. I want you to imagine you're pulling the wall down into the floor. I want you to pull down until you feel the backs of your legs turn on and your pelvis starts to tilt or your tailbone starts to scoop. Your back flattens into the floor. So there should be no space. If I take my hand and I try to slide it underneath her back, it should not be able to fit underneath there. She can feel both her hamstrings working, and she should be able to feel her heels engaged into the heel cup of her shoe. Once we're in this position, we stay in this position the whole time. I'm going to have her rest her hands down at her side here, and notice I have her palms turned up. The reason why I do that is that helps kind of facilitate and promote scapular retraction, some external rotation through the shoulders here, and I think it just kind of helps facilitate what we call apical expansion through this upper area of the chest while she's controlling down here at the ribs. So again, pulling down, wall into the floor, hamstrings are engaged. She pulls until her tailbone starts to scoop, her pelvis starts to tilt, back is flat. This is all engaged the whole time. From here, I'm going to have her take a breath in through her nose and exhale everything she can get out through pursed lips. Those pursed lips give resistance to help facilitate engagement of her internal oblique and transverse abdominis. Gentle breath in through your nose. Exhale back out. Pursed lips. Give us some resistance on that exhale. She's going to hold all the air out for a count of 3, 2, and 1. Gentle breath in. Exhale out. As she exhales out, she's being mindful of her back, maintaining contact with the floor or the table. And as she inhales, she's not losing that contact. In reality, that contact is building, meaning what we're getting is circumferential expansion, meaning she's not belly breathing, but when she takes an inhale, she's expanding circumferentially all the way around her thorax. So contact is actually going to build in between her back and the table or her back and the floor. This is very, very important. If you do not hit that piece, a lot of times people will cramp here because when they take an inhale, they start to arch through their back and they flare their ribs up and they're using their paraspinals to breathe. And that's doing the exact opposite of what we want here. Good, go ahead and relax for me. So what we would typically do is about 3 sets of 4 breaths here. And this is a way to kind of think of reposition or realign, reset, get everything where it's supposed to be. From here, let's scoot back off the wall a little bit, and we're going to go into a variation of modified Thomas stretch. Now, normally I'd be on the same side of the table as the patient or the client, but for the sake of the video, I'm going to have her scoot that way. Now, there's a specific order to this. Before we go anywhere, I need her to hug her knee up to her chest to keep her back flat into the table. Once we're here, we can allow this other leg to drop off the table. And she's gonna just let this go, try to relax down. And what we're looking for is a nice stretch across the top of her thigh and the top of her hip here. Now, we necessarily don't wanna do this if we haven't preceded it with an exercise to make sure everything is lined up and try to get us back to a neutral state of recruitment, a neutral state of alignment, because we might start stretching things we don't want to stretch, like the anterior hip capsule. So all we should be getting is just a nice gentle stretch through the front of her hip and her quad, nothing uncomfortable and painful. Most of my clients, I tell them to hang out here for nice, easy, relaxed breaths, somewhere between 5 to 7 breath cycles. And we're just going to let her hang out here, and we'll fast forward through. So quick pause here. Again, knee hug up, make sure back's flat, and then she can drop her leg. All right, so we ran through a little repositioning technique. We ran through a little inhibition technique for the anterior inlet muscles, as we call them, but basically her quads and hip flexors. And now we're going to roll through a variation of a bridge to kind of reinforce what we did. So again, I want her feet about hip width apart. I'm going to have her hold this ball in between her knees. What this little engagement does is it gets her adductors going. It helps facilitate some recruitment of the pelvic floor. So before we go anywhere, I always cue my clients with bridges to give me a good exhale and pull their ribs and their belly button down and in. So exhale all the air they can possibly get out. Now we want to hold this contraction, but we don't want to hold our breath. In this position, our back should be nice and flat into the floor, okay? And from here, we can actually bridge up. So Kayleen's going to press through her heels, keeping these ribs pulled down and in to lift her hips up off the floor, the table. And at the top, I'm going to ask her to hold for a count of 3 to 5 seconds and then go back down. Okay? A way to help facilitate this is as you press through your heels, you're going to exhale out. So blow out as you press through your heels. Now, for those of you who've done bridges, this is going to look like she's doing a half repetition. This is not a half repetition. She's just not extending her back. If she let go here and just focused on getting her hips as high as she could, we're actually promoting the thing we're trying to stop. Okay, what we're trying to inhibit here is excessive back extension, excessive anterior tilting of the pelvis. What we're trying to do here is create space through our lumbar spine, space for the facet joint, space for the nerve roots, engage the pelvic floor, get our pelvis lined up underneath our rib cage, and activate our hamstrings and our glutes. Understand when you do glute bridges, you're not working only your glutes, you are working your hamstrings. And if you disagree with that, check out the EMG studies on glute bridges. You're definitely getting those hamstrings going. Most of my clients, I have them hold these, like I said, for a count of 3 to 5 at the top and somewhere about 10 reps. Try doing those exercises in this order. There's a reason why we pick the order. It's not just what you do, it's how you do it and when you do it. Very, very important. As always, please share this video with anyone you think may benefit from it, and reach out if you have any questions. Thanks for watching.